because what we are saying to the FDA and will continue to say moving forward is if things are being slow walked or if things are being delayed for political purposes, shame on you and how dare you put politics above women's safety and health and above the lives of hundreds of thousands of preborn children whose lives are being ended every year through the scourge of abortion pills. And this, we've said this a lot, and I think it warrants saying it again, that no matter where somebody stands on the issue of abortion, if they truly care about women, they should be opposed to the way these drugs are being dispensed right now. This is not good health care for women.
Welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists, or AAPLOG. On this podcast, we bring on experts to provide insights to support you as a medical professional in your life-affirming practice and career. I'm your host for today, Jordan Butler, the communications manager at AAPLOG. Excuse me, and it's hard to believe that we've reached the end of 2025 and that this is our final episode of the year. And it's been quite a year as we have had so many victories to celebrate. And joining me today to discuss these is AAPLOG CEO, Dr. Christina Francis, AAPLOG Chair, Dr. Susan Bane, and our Director of Advocacy and Policy, Rebecca Weaver. Thank you guys for joining me. Now, while many in the pro life movement are celebrating, and rightfully so, the 1 year defunding of Planned Parenthood through the One Big Beautiful Budget Bill, that is just the beginning. APLOG and APLOG Action have been a part of so many incredible wins this year. Just to give you guys a quick teaser, you may have already heard about the APLOG Action Inspired Conscious Protections for Medical Residents Act, introduced by Representative Greg Murphy and Senator James Lankford. And shameless plug, you can listen to our episode regarding that with Dr. Bane and Representative Greg Murphy from a previous episode. And there's also our amicus brief in the Medina versus Planned Parenthood South Atlantic case during the SCOTUS hearing. And trust me, there is so much more that we're going to discuss, such as our special interest groups, our incredible membership growth, other legislative wins, and more. So, Dr. Francis, Dr. Bane, Rebecca, thank you so much for joining us today.
Thanks so much.
Excited to be here.
All right, so let's jump right in and let's just talk about some of the amazing stuff that Apple has done internally. We've seen so much incredible growth, especially among our students. Talk to us a little bit more about that and what you think is driving this interest and how Apolog is forging a new path forward for the next generation of pro-life medical professionals.
Yeah, well, I think I'll start and then maybe Dr. Bain can follow up too. But I know for all of us, this is one of our biggest areas of excitement for APLOG is the growth in our student and resident subsection and the growth in involvement of our students as well. So, I was talking to somebody recently that part of the Hippocratic oath even that we take that sets the medical ethics for us as a profession talks about mentoring those that will come behind us, talks about mentoring the next generation. So it's really something that's built into the profession of medicine. And it's something that we're very excited to be doing here at APLOG. So we started out the year with our national conference in February in Orlando with our largest class ever of students and residents who were at the conference on scholarship. We had 78, which is well beyond what we've ever had in the past. And they were able to come with their costs covered by generous donors and members who donated to our scholarship fund. And I think, for me, it was just so encouraging to be there with them and see their excitement, to see practicing physicians that are practicing from a life affirming standpoint, and also just to hear their stories of some of the pressures that they face in their schools. Many of them said they felt like they were the only ones that were pro-life, and so to come and be able to network with other students that were also pro-life, I think was just such a huge encouragement to them.
That's great. Yeah, and Dr. Bain, what would you add to that?
I think I would add that, I was a student and a resident over 30 years ago, and I trained in what's called an opt-in environment where if you wanted to learn to do induced abortions, you could have that training. And that training has changed to opt out. And the expectation is that residents, medical students, that they will do induced abortions. As a matter of fact, I've even heard it called by some people, it's bread and butter care for an OBGYN. Well, when you pull back from that statement and you say the purpose of medicine is health and healing, then the direct and intentional killing of an innocent human being is not part of medicine, and it never will be. I don't care how much a consensus that people are trying to build out there to say that death is not a therapeutic modality in healthcare, in medicine. And the students, the residents these days in academic medicine are often learning that it is. They're learning that it's essential healthcare. And if you will not do that, you should not go into our profession. And as Christina said, Dr. Francis said, when they come to our conference, when they interact with us by calling staff members at AAPLOG and talking with them, when they reach out to local physicians who are AAPLOG members, they hear a whole different story. They hear a story that is, we take care of both patients and we want health and healing and health care for both our patients. And so um, I love the fact that our membership is so excited about continuing the legacy of healthcare that is from a life affirming practice and taking back our profession because it really is trying to be stolen from us.
Yeah. And what AppLog is doing is, showing this younger generation of students and medical residents that they are far from alone. And AppLog provides that for them, which I absolutely love. Um, and kind of getting in keep going with our theme here of growth, kind of talking a little bit about special interest groups. I hear that's a new thing. So for the people out there, maybe me, that don't exactly understand what special interest groups are, what are they and why are they created and why are they important in life affirming medicine?
Well, I'll start on that one. As OBGYNs, we're specialists in women's health, but we all tend to have niches of areas that we really have a passion for. And for myself, it is pregnancy center work. I'm the medical director of 4 pregnancy centers. And so started a special interest group for those who are current medical directors at pregnancy centers or those who are considering being that. Dr. Antherica Lane has a special interest in vulnerable populations of all types. And so she wanted to start a special interest group and lead for other APLOG members who have that heart too. And so we've started with 2. I'm sure we'll grow to more. My interest in doing the medical director one for pregnancy centers was when you look at the pro-life pregnancy center movement, we have close to 3,000 pregnancy centers across the country. And I've been involved in it for about 12 years. And the one place where I thought we had a gap where we didn't have a place to network, to grow, to learn, to collaborate was actually medical directors. And I've heard our director of membership, Kathy Deeds, say that one of the most common questions she gets from pregnancy center executive directors is, can you please connect me with a medical director? And so in most states, that has to be a physician. Some states, it can be an advanced practitioner. But we want a place where you can learn to become a medical director, practice medicine at a pregnancy center, and an environment that allows that. So that's what we're doing with that particular special interest group.
That's fantastic that AppLog is filling the gap in that way. Dr. Francis, what would you like to add?
Yeah, well, and I just would add that, I mean, one, we're really, really excited about this, and I know that Susan is excited to be able, as she said, to collaborate with other medical directors to sort of share best practices and brainstorm on some of the problems that they're facing. So people might think, well, you have subsections and you have special interest groups. How are these different? So subsections are really based kind of on medical specialty. So we have our midwifery subsection, we have our student and resident subsection, emergency medicine, maternal fetal medicine. So that's, what subspecialty within women's healthcare are you a part of? So they're connected by specialty versus, as Susan said, with the special interest group, this really is, what is your passion? And what do you want to do within the work that you're doing? And so that's what these special interest groups are for. And our hope in having these is that this will actually be a tool to help mobilize our members to do more within their communities, whatever that might look like, whether it looked like working more with their pregnancy center or working with a vulnerable population, or maybe we'll have some other special interest groups. So these are really sort of education and mobilization tools, versus the subsections are a way of people within the same specialty or subspecialty of medicine to just be able to identify one another for more of a networking purpose.
Yeah, no, that's fantastic, and it's exciting to hear that AppLog is giving the tools to help mobilize our medical professionals.
Absolutely.
Um, and in regards to mobilization, a lot of people might not know, but we do have AppLog Action, which is our C4 side. We're doing a lot of mobilizing there. Rebecca, you've been listening in on this conversation, and now it's your time to shine. And tell us a little bit about AppLog Action and some of the wins that we've gotten on the state and federal levels. We've already kind of talked a little bit about the opt in abortion training policies, even talking about budget riders. So tell me a little bit about, Rebecca, what victories on the AppLog action side stand out to you and what the impact will be moving forward.
Yeah, so our advocacy arm has only been around for about a year, a little over a year. And so one of the big victories this year has just been awareness of who we are, that we are in existence as the advocacy arm of AppLog. And that includes meetings with members of Congress, state legislators, advocacy groups at both the federal and state level, and getting certain shout outs. Like, for instance, last year we were active in the constitutional amendment election to defeat Amendment 4 in Florida. And this year at the March for Life, Governor DeSantis gave that medical coalition a shout out. That's something we're going to be active in the next year as well. But so just some recognition is one victory, but really, as has been mentioned already a couple times, the biggest victory for AppLog Action this year has been the Conscience Protections for Medical Residents Act being filed as a standalone bill. And this bill, filed by Representative Murphy, who is a doctor, and then Senator James Lankford, is a policy that is a priority for AppLog and AppLog Action, because we do have these students and this next generation of medical professionals that we care about so much. And so essentially, this bill would return abortion training to the opt in system that Dr. Bane mentioned versus the opt out system that it is currently. And the standalone bill is certainly a victory on this, but a couple other ways that this has been a victorious policy for us this year is the standalone bill has never been filed in this way, and so that was great. Um, we saw in the president's proposed budget for fiscal year 26 this policy included as well, which just highlights the awareness that's coming around it of how medical residents are being forced and coerced in this certain system of opt out training, and how important it is to rectify. And then lastly, with the budget writer, we have been successful in the past of getting a provision in the budget. So one of the budget bills, right? There's a bunch of them about this policy, again, to return it to an opt in system. And for the first time this year, that policy included in the broader bill, the broader budget bill, has actually passed the House Appropriations Committee. So it's made it the furthest it ever has. And so there's still a lot of work to do to make sure that this policy is put in place and protects future medical professionals who are in training. But it's also, I think, important to stop and celebrate how far we have gotten with this, further than we ever have before, to hearten us to keep going for the next year.
No, that's incredible. I mean, for only being around for around a year, you guys have really, really made a dent. If there's anything that Dr. Bang or Dr. Francis you'd want to add about just the importance of this Conscious Protections for Medical Residents Act.
Well, I think, one thing I'll add is that we have definitely heard from our students and residents how thankful they are that this policy is moving forward, even though it's not a law yet, and there still may be a long road ahead before it becomes a law. Just the fact that people are hearing their concerns and doing something about it, I think, is a significant encouragement to them. And I just, when I was on the Hill yesterday, as we're recording this, and talking to some congressional offices about this bill, I was talking with a colleague, actually another one of our board members, Dr. Ingrid Scott, who said that because of this pressure to perform abortions or participate even in abortion prep and counseling, there was a student that she had been mentoring who had really wanted to go into OBGYN, but had recently told her she just didn't think she was going to be able to do it. She was really struggling with the thought of being facing that much pressure and having to sort of stand up to that pressure day in and day out. But hearing that this was a possibility, but also the mentorship of a pro-life OBGYN and the presence of APLOG, and knowing that APLOG was behind her and would defend her right as a resident, she just told Dr. Scott recently that she has decided for sure to pursue going into OBGYN. So to me, that is all that I need to know, that we are doing what needs to be done. Of course, we're going to continue to celebrate lots of other wins, but I just wanted to add that even just, again, even though it hasn't passed into law yet, even just hearing that we are doing this work and that their stories are being heard is such an encouragement to students.
Yeah, it's so important for there to be a pro-life medical voice within the pro-life movement, and also on the Hill as well, and in the states. One of the things that we have been very vocal about, which a lot of other pro-life groups have been, thankfully, is about the harms of chemical abortion pills. And, we've been helping raising awareness, reports, and advocacy efforts. And this is a question just for the entire group about, how do you see this shaping the conversation around chemical abortion pills in 2026 and beyond? What does that look like for APLOG as we move forward?
Well, I think, one of the things we were active in this past year in 2025 was we have been alerting the FDA to our concerns about the abortion pill and how complications with mifepristone. And we sent a letter along with 5 other medical professional groups representing in total over 30,000 medical professionals to the FDA, and highlighting these concerns, highlighting how we are calling for the REMS to be reinstated, and a safety evaluation to be conducted by the FDA to really look at all of the complications that have been shown in other reports. And there's some disheartening news that came out as of the recording this week, about the FDA reportedly slow walking evaluation of safety analysis data for political reasons. And so I think what that reiterates for us is that our work is nowhere near done, and there's a lot left to do. And like we just talked about, all these victories, it's good to stop and celebrate them, because it gives us the motivation to keep working in the next year on petitioning the FDA to take action, and using other avenues as well, right? Working with our members of Congress and working at the state level, with what we can do at the state level to try to push back on the harms that are coming from abortion pills. And that's from an advocacy perspective. I'll let the doctor speak to it further on that.
Well, I'll add actually and give a shout out to Jordan, as leading in communications here at APLOG. One of the posts we saw just this week was from Medical Students for Choice, and they really romanticized what a self-managed at-home abortion is like. And we provide, as doctors, actually an alternate voice of what we actually see. As the medical director of 4 pregnancy centers, it's nowhere close to that. Yeah. The stories I hear over and over are women who get substandard care, whether they are going to abortion clinics, they don't get individualized informed consents or follow up opportunities. Many don't even get ultrasounds. And then you have women that are going online and getting absolutely no ongoing medical care. I'm actually on a lunch break at a clinic today at one of my pregnancy centers and just saw a patient who's 6 weeks post using these abortion drugs who now has a fever and retained tissue. And we know from some of the reports that have come out this year that the risk is high for hemorrhage and infection, and it's higher than what the FDA data suggests. And we really are calling for further ongoing studies. As I told a second patient this morning who didn't understand why she couldn't just shouldn't go online and get abortion drugs. I said, if you're going to move towards abortion, I know your baby's going to die, but I don't want you to die too. I want you to be safe. And the way abortion drugs are available um, today is not keeping women safe, it's harming women.
Just to piggyback on what Susan said, and Susan, I think it's so timely that you shared those stories of the women that you saw even just today, because what we are saying to the FDA and will continue to say moving forward is if things are being slow walked or if things are being delayed for political purposes, shame on you and how dare you put politics above women's safety and health and above the lives of hundreds of thousands of preborn children whose lives are being ended every year through the scourge of abortion pills. And this, we've said this a lot, and I think it warrants saying it again, that no matter where somebody stands on the issue of abortion, if they truly care about women, they should be opposed to the way these drugs are being dispensed right now. This is not good health care for women. So even people that think that women should have the right to have an abortion should be opposed to these drugs being dispensed online by pill pushers, many of whom are not even medical, who don't assess women for their risks associated with these drugs, how far along they are in their pregnancy, whether they have an ectopic pregnancy, which is life threatening, or whether that it's an abuser ordering these drugs. How many more stories have to come out in the news of abusive boyfriends and husbands who are forcing these drugs on women, forcing abortions that are not wanted? I start getting a little passionate when we talk about this because I think all of us here are fed up with this. We are fed up with empty promises and what are seem to now be lies. I don't know. I guess time will tell. We'll see. But we're fed up with it because we have brought this issue over and over again. Many people have brought this issue to the FDA's attention to say that it needs to stop. And what they can do immediately is to put back into place the in-person dispensing requirement. That was what was going on under the first Trump administration. So it would just return it to, the status that it was under the first administration while they do a more thorough evaluation of the complications that are occurring right now. And then our hope would be that they would reinstitute all of those original safeguards that the FDA itself said were necessary when they approved this drug in order to minimize the risk to women. So we will continue to sound this drum. And again, I think this highlights the importance of APLOG existing as an organization because other medical organizations like the American College of OBGYNs have thrown out good medical practice. They've thrown out the medical evidence in favor of a political position that says abortion without restrictions and without barriers, and no in-person visit is necessary. So it's so important that APLOG exists as a medical voice to say this is what the medical literature actually says, and we care about our patients, and because of that, we need to put these restrictions back in place.
Yeah, no, I agree with that. And just kind of to add, as a non-doctor, I at one point was wanting to figure out, how easy it is to get these pills. And I went to Plan C and I said, "Oh, I'm 15 or 16 weeks pregnant." I wasn't telling the truth. And they're like, "Oh, you can't get these pills." So all I had to do was just go back to the next page and just say that I was 8 weeks pregnant. And then it's like, "Oh, now you can have the pills." That's how easy it is. for people to get them. And Dr. Francis, you talked about abusers being able to get a hold of them. That is literally how easy it is. It's as easy as ordering a Starbucks coffee on your app, and it should never be that way ever. So I get passionate about it too, Dr. Francis, and I appreciate both you and Dr. Bane sharing that, and that we're going to continue to be fighting chemical abortion pills as they become more prevalent in society, which is terribly unfortunate. But there's plenty of things to celebrate, though. We're ending 2025. We're heading into 2026. A lot of exciting things. This is kind of a question for the whole group, but Dr. Francis, I'm going to give it to you first about what you're excited about for AAPLOG's future in 2026 and where you really see us going and making waves.
Absolutely. Well, as you said, there have been some challenges, but we're also very excited that we know that public opinion is starting to change on the issue of the safety of abortion drugs, and so I'm excited in 2026 to continue to highlight the stories of women who have been harmed by these drugs and hopefully make a real difference there. And for the start of the year, I'm excited about our upcoming conference that's at the end of February in Seattle. I'm excited to be in a place like Seattle, actually, a place that has unfortunately embraced the, abortion through all of pregnancy agenda. But we're excited to bring a life affirming voice into that place. So we're excited to be there and have amazing speakers and really excited to bring students. We have lots of student applicants right now that are awaiting funding. So I'll use this as a brief opportunity to plug anyone who's listening who cares about students to please donate to our scholarship fund to help so that we can get to our goal of 100 students this year at the conference. You can go to applog.org/donate if you're interested in that, and I'm sure we'll put that in the show notes. But I'm really excited to, it's such a encouraging time for all of us every year as we get together, not only to learn amazing things, but also just to network with one another and be an encouragement to one another to continue to change medicine towards a more life affirming approach.
Yeah, I think for myself, our former CEO, Dr. Donna Harris, always says courage is contagious. And I think that momentum is here. Just in the story Dr. Francis shared earlier about the student who's being mentored by Dr. Scott and her change of heart, that she's not afraid now to go into OBGYN. Um, I think this momentum is happening both in the next generation, but also in the current generation. 93% of doctors outside of academic medicine of OBGYNs, we don't perform induced abortions. It is not standard of care in our practice. And more are joining APLOG and recognizing that and speaking in their local communities, in their practices, in their hospital systems, in their states, and joining us in DC to talk to Congress. And so I'm excited about the energy that we're returning to the roots, as Dr. Francis talked about Hippocratic medicine. Um, we're not being hijacked by this false narrative. We're providing a narrative that is true medicine.
Thank you, Dr. Bane. And Rebecca, lastly, anything that you're excited about on the AppLog action side for 2026?
Yeah, I mean, it's not exciting to think about the fact that states are having pro-abortion constitutional amendments on their ballots. But what is exciting is states like Missouri, where they're pushing back on that, and they're going to have a pro-life constitutional amendment on their ballot. And what's also exciting is that we have, as Dr. Bain mentioned, courageous medical professionals who are willing to step up and use their voice to talk about the harms of we talked about abortion pills, and in this instance, these constitutional amendments talk about the dangers and how they're bad for women, bad for the profession, and how women deserve better, and certainly preborn children. But we've kind of been talking about just the dangers and harms to women in this. And so that excites me for the upcoming year to see how we can continue to mobilize medical voices and use them for life, and to push back on the harms of abortion that the other side is trying to perpetuate now at every state level.
Yeah. For sure. And as the new communications manager, I'm so excited to join AppLog in this journey and everything that 2026 holds. There's a lot of things that we haven't discussed that I'm sure you'll be seeing in 2026. And we're just so excited about the growth that we've had and even more growth that we're going to have in 2026. So, Rebecca, Dr. Bane, and Dr. Francis, thank you so much for joining today to end this off. And we'll be kicking off this podcast again next year after a quick little break. But we just want to thank you guys, our listeners, for joining us today. And if you like this episode, it would be so helpful to us if you gave us a like and if you subscribed on YouTube, or if you're listening on Spotify, Apple, or Google Podcasts, make sure to give us a 5-star review. It would really be helpful. And also, as we've talked about already today, AppLog is one of the main pro-life medical voices that is offering clarity in the midst of confusion. So if you want to support what we're doing, make sure that you donate. We can do this all with your dues and your support. And we appreciate everything that you've done for us, and we will see you in our next episode.